Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of Health, Safety, Emergency Preparedness, Ethnic and Nonprofit Agencies, and TPT's Minnesota channel.
Hello and welcome to ECHO, Emergency, Community, Health and Outreach. I'm your host, Lillian McDonald, Executive Director for ECHO. ECHO brings you information in multiple languages using multimedia formats. Our program this time is Community Strength and Preparedness. We have a couple of guest experts, but joining us. But first, we'd like you to watch this.
At some point, all of us will have to deal with some sort of crisis. The crisis could be a family emergency, or it could be an emergency that affects the entire community, such as a flood or tornado. It might be something bigger, such as an earthquake or an epidemic that involves an entire country or region. Before a crisis happens, we can help our chances of successfully dealing with it by making ourselves as physically and mentally healthy as possible. We can also learn from how we handled hard situations in the past. That can help us get through a new problem. This idea of being able to handle whatever comes our way is called being resilient. It is important to build resilience before an emergency happens. Individuals can be resilient, and so can communities. You and your family can be ready by taking responsibility for your own health and safety. Make sure you are in good physical condition by eating right, being active, and not smoking, and by being as safe as possible. That means doing things like wearing seatbelts, installing smoke alarms, and having a family safety plan. You can also build resilience by learning from day-to-day experiences and being aware of what you're good at and what you need help with. For example, if you know you're good at knowing where to find reliable sources of information, then you can help others find accurate updates from groups like ECHO. In an emergency, it's likely that families will have to rely on each other. At those times, family members who have already been through some sort of crisis will be able to use that experience to help others. As a community, we can be strong and prepared by working together and helping each other. Be familiar with what's available in your community if there's an emergency. Decide on a safe place your family will meet if you can't be in your home. Learn what supplies you should get, such as an emergency kit or food supplies. Help make sure they are stocked and available. Be prepared to volunteer. By helping out either before or during a crisis, you will be helping everyone who lives there. An important part of being ready is communication. Find out all you can during a crisis so you can tell others valuable information, like where to get help and how to keep things from getting worse. Be sure to check on neighbors and family members who might need help. Make sure they know about the emergency and what to do. And as you communicate with people, it's very important to show compassion. Anything you can do to help ease someone's pain will be a big help to both them and your community. It is also important to stay calm in an emergency. You can help others by listening to them and getting them help. Communities need to take care of themselves and each other, especially in an emergency. By relying on everyone's experience and strengths, we can work together to be ready for any emergency and make it through a crisis when it happens.
Welcome back. You're watching ECHO, Emergency, Community, Health and Outreach. I'm your host, Lillian McDonald. Our subject this time on ECHO, Community Strength and Preparedness. Joining us are two guests. First, we have Jonathan Bunt from Mesa Consulting. And Jonathan, we'll talk more about your expertise on this particular subject. And then also joining us, Ms. Mao Tao, who is a health educator by day for St. Paul Ramsey County Public Health. And in her spare time, she works with ECHO as one of our bilingual spokespersons. Welcome.
Thank you.
Thanks so much, both of you, for joining us on the program. Jonathan, talk a little bit about your experience. You have experience in psychology. You help people through crisis, through problems. What exactly do you do that helps us when we talk about resilience?
I'm a disaster and crisis specialist, and what I try to do is marry two special worlds, the world of mental health and having training in a professional mental health provider in our community for many years. And also, I am very involved in emergency management, a certified emergency manager, and I take those two worlds together to really look at how we build resilience in individuals, communities, and in our family systems in larger pieces as we go along.
And John, you describe it perfectly. Two worlds is a good way to put it, because it really is two worlds. Mental health requires specific attention, specific resources and help, as does emergency response. Now, this topic that we're doing for this ECHO program is really the result of what we've learned about crisis and emergency management over time. What do you mean specifically when we're talking about crisis? Let's label a crisis.
Sure.
Because there's all kinds of crises.
We look at crisis in a lot of different ways. I want people to think about crises that are part of natural disasters. Flooding. Our community here has flooding. We have tornadoes. Tornadoes impact us on certain seasons. But also think about different things that might happen where we have more of a technological disaster, transportation, airplanes, planes, cars. We also can have things that are like pandemic or flu. All different types of outbreaks can impact us in different ways. Chemical spills, other types of things. And you know what? In our world is dealing with a lot of disaster that's created by people. War atrocities, terrorism can also be part of this too.
So intentional crisis or man-made cause crisis. Now, Ma, we brought you into this program to tell a little bit about your story. Sometimes, you know, we're born into crisis. We're born into situations. If you could take a moment and tell us a little bit about where you come from and the crisis that you kind of grew up in.
Well, I can remember I was born, you know, a child, what you call it, of war. And so that means that every 2 or 3 years we would escape from one town to the other, from one jungle to the other. So that's my childhood memory. It's just to, you know, escape from one place to the other and not really, you know, feeling secure or really getting to know a place or in an environment or people. You're always, you know, meeting new people and always feel like on the run.
And John, the basic need, as we've studied it and we teach it in school now, the very first basic need that everybody needs is safety. It's
Absolutely.
Security and love and being cared for. And Mao didn't have that growing up when she got a start in this world. When you grow up in that kind of a situation, you grow through and you grow through a lot of emotions. And when you are impacted by any crisis, you're faced with emotion. How does that impact you?
Well, we have two different things to look at. We look at short-term impact in the moment, involvement in a fire situation. Even as a child, you will think about that in a short-term manner, and you'll deal with it in a short-term manner. But it also can have long-term effects. The long-term effects are really vary from person to person. It could be very debilitating, or it's part of your memory, how you build and grow resilience in your life to deal with other events that happen. An earthquake, natural disasters, and some of the things we hear about nuclear or radiological things too.
Those are massive crises.
Absolutely.
Would you say growing up in your environment in war-torn countries, moving from every 2 or 3 years to survive, has changed you?
Yes. You have no choice, but you have to change in order to survive. So I think for many of us, we have to sort of like die before you know, you have to consider yourself dead to be alive.
Wow.
Because, you know, everything, you don't know the future, you don't know what's, you know, what holds for you and where you're going to end up or where you will be living or if you will have the next meal. So really, you have to consider yourself dead.
So that's an interesting perspective. That's living with uncertainty, which a lot of these crises invite.
There's a lot of uncertainty, but Mao presents a uniqueness in her way of framing her own resilience. Mao, you talked about this in a way of, here's how I knew that I can continue living. The way for you was thinking that I have died, but now it's a reborn and coming forward. And people allowing themselves to have the flexibility to see an event as a possibility and an opportunity instead of seeing it as something that has stopped us in our tracks and actually became a victim of it. And it's more than even surviving, it's thriving.
Now, that's a key, because when we have a crisis, the first thing officials will say, we're going to do the best we can to get this community back to normal, right? Back to normal. But isn't there a new normal after crisis?
I have to be honest, I struggle when people use the term normal, because the reality is you can't go back and have it exactly the way it is. And actually, it's not healthy, because you need to look at what's happened, but what's new for this? How do I grow from this? And actually even take the term normal out of it. I'm learning and I'm growing and I'm better. And humankind has really evolved to be better because of that's how we live.
And that is what resilience is. Is that what you described, the core to resilience? Is you not only got yourself back together again, but you're stronger. And you've learned from what happened.
And it's coming back, and having resilience is about seeing these events in actually unique, positive ways, but respecting what has happened to us, each other, our families, and our communities. It's that being able to bounce forward.
Now, we'll talk more in a moment about Mao's story, because she has quite a story about how she not only lived through a lot of change and survival situations, but then has also managed to use her resilience to give back to the community. Let me talk to you for a moment, just take a sidebar so that we can prepare. Because isn't the key to some of this ability to survive and have resilience to think about it so that you're kind of ready when the unexpected may happen?
You know, it's so important to have, first of all, the awareness that clearly things happen that we can call a crisis or a disaster, and that those things will affect us. It's the awareness that it's going to affect us that helps us be better at really responding and being effective. And that is really the beginning point in our emotional, psychological, even spiritual survival.
So again, some clear ways to prepare for something like that. How?
So once we have the awareness, let's take a look at a couple different things. Do you physically you're prepared? For instance, if we know that a flood is coming, or if we are aware that storms are brewing. But in general, having in your home basic emergency supplies, clothing, extra food, the ability to communicate if you don't have electricity. That means that maybe battery-powered radios.
Right.
Those types of things.
So in this community that we live in, get familiar with it. Here in Minnesota, we know we have tornadoes, we have flooding, we have severe winters. Now, language plays a key role in all of this, Mao, and I know you're fluent in 4 languages, right? But if you are not a native speaker of this language, being able to communicate and prepare for emergencies is also critical, right?
It is very critical. That's when people rely on families, friends, relatives, or neighbors, and an ECHO program, for example. So it's so crucial that we are able to communicate and relay the messages in the different languages. I think that's so important in the different LEP community.
And by LEP, she's referring to limited English proficiency communities, which we're trying to, again, assimilate and integrate communities into how systems work here. So families can protect themselves at home, but what if they're away from home? What if your children are at school and you have the crisis? How do we prepare for something like that at school or at work?
So what both of you are talking about is the hub of critical elements of responding to different events is having a communication plan. Plan to communicate within your family and your direct family or family that you have or friends you have outside of where you are physically, other areas of the state or out of the state even. Have a plan. Our schools and our places of work typically have emergency plans, and it's important to become aware of what those plans are. They have emergency notification systems. They have ways for you to call in and to find out what's happening. And through different programs, that can be the internet. A lot of these businesses and schools have internet programs where they will post different things that are going on to direct you to what to do next or how to get more information.
And once again, communication is key to that, which is why we have the pleasure of working with Mao, who can help ECHO communicate to Hmong and Southeast Asian families here in Minnesota. There are lots of things to consider in a crisis, evacuation plans, working with your school for your children, working with your employer. This is the kind of information that we need to do before the crisis is happening. But what if we're right in the middle of it, John? What can we do if it's happening right here, right now? What can I do if a fire broke out in my home? Or if there was a flood in my neighborhood? What can I do right now?
If we're thinking about the moment that something is happening and going on, our number one priority is our own safety. Getting out of that space. If there's a fire in your home, hopefully you have a plan for getting out. You've practiced that plan. We know that practicing plans of evacuating, getting out of a building, having a safe place to reunify is important, and then being able to communicate with whomever you can. And having that plan, exercising that plan, safety is number one for you. To get out and get to even across the street is a good start. Next is letting people know where you are or what's going on. That's calling 911. And also let's remember, even with limited English language or even no English language at all, they have the ability to translate language lines for the 911 dispatchers. Let people know what's going on.
Now, in some instances, Mao, there was no technology to support the translation of information, and there's a lot of context that is lost when you are translating information. But for your community, and I know I'm asking you to generalize a little bit here, how important is it to work with members of your own culture and members of the integrated culture that you live in?
It's very important for people, the community. I think people rely on relatives, families, and perhaps it's faith communities or organizations that can understand English and can find out information resources. And so for the folks that do not speak English or understand English, that's the first sort of like people they will go to, they will call, they will ask. Rather than calling 911, they may call their brother or their mother or their daughter or
who is
sons.
not an emergency manager and a top information expert on the crisis
but who
at hand.
Perhaps they trust and can relay the message. Can call 911, for example.
And you may be talking about two differences in how we handle crises here in this country versus crises in other countries too. But that's why it's important to know where you are, how does the system work, and how do I take care of myself and others. Mao, you've had an experience to give back to the community as a health educator, as a multilingual person, and a communicator with your public health background too. You actually went back to the refugee camps where you come from in Thailand. Talk about that experience and giving back to the community.
Yeah, I'm pretty privileged to have the opportunities. I went back to work in a camp twice. First time was with in Pananikum refugee. And the second time was with the, with Mayor Kelly's delegation prior to the last refugee coming to the U.S. And it was, even though I was, a refugee and lived in refugee camps before, going back to work there was different. Being away from the refugee camp or the community for so long, I was in shock. Shock within my own culture. Yeah. And seeing sick people, seeing malnourished, patients, families, children, elderly, it was quite painful to go through that. Again, all over, it really invoked a lot of pain memories, in you, in a person, a lot of, flashback, thinking about the things that happened to you and hundreds of people in the old days. But it was, so helpful in going back and being able to give back to the community, being able to have a sense that you can contribute this time. Your first time being a refugee, living in the refugee camp, you feel powerless. You couldn't do anything but do what you were told to do. But going back to work there, it gives me, honor and pleasure to contribute back. Talking to people about health, getting immunizations, work, nutrition, TB medication, or just helping people understand more about Western health and practices. It was really quite powerful for the people.
And she's talking about taking resilience to a whole new level. She's made it a part of her life. This is what you were talking about, the importance of really kind of embracing the trauma, living through it, and then succeeding and then giving back. Is that what we're looking for?
I mean, we have to be open, and Mao is open to the idea of letting these events be something else and giving back. And I think it's an important goal for us is how much can we give back to our own family, for sure, but giving back to our neighbors, our community, the place we live, and the places that we've been in our life in order to help us. And these memories come up at all different times. And some of these crisis or disaster events can trigger memories of other crisis and disaster events. And that's not a bad thing. It's a life thing. That's how our brains work. And it's allowing ourselves to go down different paths, and helping others is an important part. But you'll have to be calm. And all these events have to drive a sense of trying to be calm so you can sort and understand this. And that's not always possible.
No, and they take time, too. And John, there are some symptoms, too, that we should mention, that there are some healthy signs when you are being resilient and moving through the crisis in a healthy way. And then there are some things that kind of give you a message that you need to take care of. What are some of the symptoms that we might look out for?
Well, in general, we have to understand, and this is an important thing, is that in many ways you have to expect that you're not going to feel yourself. You're not going to feel that there's something wrong, but I'm not sure how to put my finger on it. And a lot of times people think that there's something profoundly wrong. I mean, if it's problems with your sleep or your changes in your appetite, different things can play out. Sleep issues is very predominant. Appetite issues happen at times, but other things, I don't want to be around people, or I get really upset and angry easily, or I get sad. These emotions flow through us, and that's understandable. Over time, they get better. A few days, few weeks, when we have a disaster event. And that's important to know some of these things, because you might be dealing with them.
And there are resources, places where you can go to get some help, trained professionals that can help you over time heal, and that's what it takes, right?
Part of it is that time heals, but that's not always 100% true. Time is helpful if you're doing things that are helpful for you.
True.
If you eat well, you exercise, you let people know what's going on in your life, you communicate, you get support, you reach out to different community resources along with your family.
Mao, is that what happened to you? Now, I know I may have just put you on the spot
yes.
right there, but did you have the resources, or did you just sort of make it up? Or?
I think at first, with the first refugees, we didn't have much, resources.
Yeah.
And then we had to rely on each other. Right. So we did a lot of, friends talking and trying to survive, by ourselves. And then, lots of, not just among friends, but, friends, who has, who are born here and raised here and who know the country very well. So those are people who you look up to and who could really help you. But, I think being able to recognize, what you went through and take advantage of some of those and make things better for yourself, and being able to live, to discuss and to learn from that and bounce, make things better. I think that's important, but I know that it's difficult for everybody to do.
Sure, not everybody. I mean, they're all different kinds of levels, and we're all at different stages, and I'm glad you were able to give back. It's a privilege to be able to work with you and ECHO and all the activities that we've done together and will continue to do on our programs. And to give back to the community is a clear, healthy sign that you're well on your way and moving through. Places where people can go to get help, your medical providers in particular, emotional, behavioral health providers, another, spiritual providers, yet another.
And typically our schools will have resources not only for your children, but also for you if need be. Our workplace has, through insurance, through employee assistance programs, which are counseling programs. Many faith-based communities will have resources. And also during times of disasters, we have local organizations like the Red Cross, Salvation Army. These are volunteers who go out and help. And, community resources like our public health in different places that we live have that type of thing that I think are really helpful. And when you're not sure, you go for access points like the Red Cross, or using United Way, which has systems like 211 in our community that you can call and get some help
All as
with.
communicated. Thank you very much, John, for your time. And you,
Thank you.
Mal, lots of things we've talked about on this program. Let's summarize with 3 key messages. First, prepare yourself and your community for emergencies. Second, know what's available in your community to help when there is an emergency. And lastly, use your experience and strengths to help yourself and others. There's a lot of information on this program. My thanks again to our guests and to you for watching. I'm your host, Lillian McDonald. You've been watching Echo Minnesota. For more information about this program and our other programs, please visit our website, echominnesota.org. Until next time, make it a great day.
Echo TV is a co-production of Minnesota's Emergency, Community, and Health Outreach Collaborative of Health, Safety, Emergency Preparedness, Ethnic and Nonprofit Agencies, and TPT's Minnesota Channel.